And now I would like to introduce all of you to Mark Gottlieb. He is an independent insurance broker. He's worked for several large insurers in the past, but he likes to be an independent broker so he can offer up as many plans that are available. And I'm now going to turn the floor over to Mark.
Yeah,
I'm going to go get my.
all right. All right, thank you. Good afternoon. Sorry, it's a little hard to see me on these angles. So, in any case, more important when we can see the slides. That's what's most important. So delighted to be here today. And now let's see why this is not advancing to the next slide.
I'll go to show.
There we go. Okay. Yeah, just a brief introduction. I have previous activity in the healthcare and senior industries and then transitioned into insurance. Actually started out focused mainly on long-term care insurance. As more and more people expressed an interest in Medicare, I kind of dove into the world of Medicare. So I'm certified to sell all of the Advantage prescription plans and most of the good supplements. So I pride myself on being able to offer people information about the full array of products as opposed to most companies, which each of them kind of tell you why their product is the best. I participate in many presentations and with many organizations. So just a little bit about me. So I start out before getting into the A, B, C's, and D's of Medicare by talking about enrollment periods. So of course, there's the initial enrollment period around age 65 if a person continues to work and has insurance through an employer.
Okay.
Okay. Yep.
Friday.
See you on Friday, normal time, right?
Yes.
Thank you.
Instead of transitioning to Part B and other supplementary products. Of course, again, that depends on how good your employer insurance is. If it's very good insurance and the premiums are reasonable, it's great to keep it. If not, you do have an option to enroll in Medicare instead after the age of 65. We're in the annual enrollment period now, October 15 to December 7. You can enroll or change enrollment in Medicare Advantage or prescription drug plans. Medicare supplement is not part of the annual enrollment period, so people should be aware of that. There's a lot of confusion about that. And I put in the note, government and under 65 falls under open enrollment, so you may be seeing a lot of information on the television ads, for instance. Hey, open enrollment is November 1. Well, now I'm confused. For Medicare, annual enrollment is October 15 to December 7. So this is great timing for providing an educational session. Now, there is something called open enrollment. And again, this is confusing because even a lot of people in the Medicare field refer to this as open enrollment. But frankly, technically, it is now annual enrollment. The open enrollment period starts January 1, goes to March 31. So let's say you're in an Advantage plan, you don't do anything now, then in the new year, you think maybe I should have done something. Or you sign up for a plan, you start using it in the beginning of the year, and you realize I really didn't understand it as well as I should have. And is there a chance to do something different before having to wait a whole year till the annual enrollment period? The answer is yes. The open enrollment period, I kind of call it a do-over. Now, during that period, people can also decide maybe I shouldn't have signed up for this Medicare Advantage plan, and can I get out of it and go back to original Medicare? The answer is you can go back to original Medicare, Parts A and B, and Part D. But here's the issue. You need to know beforehand, do you qualify for enrolling in a Medicare supplement plan to fill the gap that A and B leaves for us, okay? If you cannot qualify, then be very careful about getting out of Medicare Advantage, because it's gonna then leave you with that 20% gap. That's very important to understand. By the way, if there are any questions, I'm happy to, respond to them in real time. It's not that big a group. I'm happy to do that, or we can wait till the end. Quick question?
So you're talking now about open enrollment for people under 65?
No, I'm
No.
talking about open enrollment beyond the annual enrollment period. This is strictly Medicare. I'm talking nothing about under 65.
Okay,
All right, then of course, there's also a number of reasons that one might have a special enrollment period. I use the example, let's say you have employer insurance, but you're gonna be retiring, or you lose your job. And it's now April the 1st. Do you have to wait till the next annual enrollment period? No, you're in a special enrollment period. You provide documentation, typically a letter from the employer or the employer's insurance company, group plan, showing that you're losing your coverage on a certain date. You then immediately turn around and sign up for Part B, and then typically either then a supplement and a Part D or an Advantage plan. A lot of other reasons for special enrollment. If you're moving into a nursing home, you have the right to change your Advantage plan from one to another. If you say, let's get divorced or lose a legal partner's coverage, you can get your own during special enrollment period. If you change your jurisdictions, you can get coverage through a special enrollment period. You decide to move somewhere else, you need to change your coverage, because Advantage plans and Part D plans are covering people by jurisdiction. It's different than a supplement, which I'll get to. A supplement is portable, you can take it anywhere in the country. I'm going to be running a lot of things by you all during this next hour. There's a lot of detail. I find it hard to leave the detail out, otherwise I don't give you the full picture. But I'm happy, if we don't get to it today, I'm going to give you my email address, my phone number. Feel free to check in with me. There's no fees. I will provide the follow-up information you need or the clarification.
Isn't it?
Okay, so qualifications for Medicare, you can either be 65 plus, you can wait until your employer coverage is gone. I can't seem to get this little thing off. I don't want to mess around with it. People who are on Social Security disability income can get onto Medicare after 2 years. You might have SSDI because of an injury or an illness, you're not able to work. You're given SSDI coverage, and after 24 months, you can sign up for Medicare. You can also, if you have end-stage renal disease, you can sign up for Medicare immediately. If you have Lou Gehrig's disease, you can enroll in Medicare immediately, okay? So now we get to the parts of Medicare. I'll try to get through this as quickly as possible, because I know the main focus during annual enrollment period is talking about prescription drug plans and Advantage plans. And then supplements if you decide to try to change out of Advantage. Part A, typically $0 premium for those or spouse or legal partner who have contributed for 40 quarters at 10 years. So the vast majority of people I run into meet that qualification. They have Part A for free. You just sign up. For all of this, for Medicare, you can sign up on ssa.gov or medicare.gov. And you tell them what you need. If it's only Part A and you're still working and have coverage, make sure you specify I'm only signing up for A. Okay, for people who move to this country, let's say late, never contributed to the Social Security system, they can purchase Part A coverage. Right now, my number is $509 a month. I think it's going to be a little bit higher for 2026. I'm still waiting for some figures. I have a number of them, which you'll see, but on that one, I don't have it yet. I'm waiting for the final numbers presented for Medicare and Medicaid services. Part A also covers short-term nursing. If you're in a hospital, they don't feel like you can safely go home for a short period of time, then they send a nurse and get covered through Part A. It is not by any means long-term care, and they won't just send an aide to help you with your activities of daily living. It's mainly focused on medical needs. Okay, so that's post-hospital. Part A also covers a program called hospice, which is for those with a terminal illness. Probably 70% of people on hospice have some form of cancer, but there's 30% with a number of other terminal needs. The deductible, now there is a Part A deductible. Now, if you have either supplement or advantage coverage, you don't have to worry about the deductible. For those who only have A and B, there is a deductible. It's $1,676 right now in this year. It's going to 1716 projected for 2026. So as I said, if you have most supplement plans will cover Part A hospital deductible. If you're in an Advantage plan, you won't have to pay the deductible, but there's a number of copays for Advantage plans, and one of them is the first 5 or 6 days of hospitalization at a copay. So anytime you get information from an Advantage plan, you look at summary of benefits or outline of coverage, you're gonna see one of the items is hospital typically first 5 or 6 days at somewhere between 350 and 375 a day. So it kind of takes up for the Part A hospital deductible that you don't have to pay. You will have those hospital costs. Okay, so that's important to realize. Part A also pays for the first 20 days of care in inpatient rehab or skilled nursing. So you have any number of many issues, you had a stroke, you had an accident, you have a serious cardiac situation, neurologic, on and on. You're in the hospital and they say, really, you don't need to be at this acute level of care. We're going to transfer you over to a skilled nursing or rehab center. If you've been hospitalized for 3 days, then those first 20 days will be covered fully.
And also, the problem with all the,
Olga, can you?
Sir,
You-
somebody is not muted and it's hard to hear you with background conversation.
of course, the chat does not
Olga,
write
Olga,
nice that you can,
Olga, you need to mute yourself.
or a robot or whatever you have
I'll try and talk above her. I don't know what else to do.
to survive. And I happen to be an international economist, okay? I've closed down many companies in my life. So I'm saying this, if you really want to survive and have customers of people that have special needs, you need to have an open line. For
Yeah, that's
them.
what I'm looking,
Understand?
Olga right there, okay.
Because one problem that I found, I had an appointment at the beginning of
Wait a minute.
last week, I think, I'm not quite sure which day.
Get Olga out of here.
And it turns out
Oh,
that the person I spoke to first, I did get
I gotta, somebody should call her.
Yeah.
Yeah,
What
okay,
I'm
good.
gonna say.
very intelligent, I must say. I got one on the line and she made the appointment.
Get out there.
Problem is, and I told her specifically,
Eliminate.
take off my original home phone because I have that line closed because of, a lot of people asking for money and this, that, and the other thing and spam kind of things. So I only open it for outgoing phone calls. I have my regular smartphone that I use
Participants, okay.
for the normal process of,
Tell you, Mark.
Pardon the interruption. We'll be back shortly.
and it turns out that of course I had the wrong number. So when the fellow,
No one can hear.
he could not,
We try and ask a question, will it drown it out?
and after all.
Yeah, when you ask a question, we can hear, we can focus our voice.
Let's hear it.
I did have a question. Maybe you were coming to it about the lifetime limits on the hospital and the nursing home.
Well, they're not lifetime, they're annual. And
But aren't there also lifetime limits?
Anyway,
there's a lifetime limit for the number of hospital days for
Yes.
psychiatric care.
please
But
send,
that's about it, really. Hospital will be based on,
if I have a question, because
very hard to even hear myself think. It's actually medical case, which I'll get to for hospitalization, but it's usually based on a benefit period. So let's say you have one problem, you're in the hospital for a period of time,
Francine.
you leave, something else happens, a new benefit period starts.
It's all just muted, but now we hear you, Francine.
Oh, God.
Mark.
Well, let me get out of here.
Okay, thanks.
I'm gonna continue as loud as I can.
Okay, I can't do this.
All right, so first 20 days, free, days 21 through 100 if you're in a skilled nursing or rehab facility. It's this year, it's $209.50 per day, going to $214.50 in 26. Very moderate increase. That's a blessing. I don't know how we got away with that, but that's a good thing. And once you're in the skilled nursing facility for 100 days, on day 101, it falls into long-term care. There's no longer payment. All right, so let's again see if I can get this to move forward. We're going through everything today. Okay, so that's part A, mainly hospital and post-hospital. Part B, as you probably know, 80% of outpatient costs are covered by Part B. That's everything from physician visits, emergency room, ambulatory surgery, diagnostics, MRIs, therapies, everything out of the hospital is Part B, 80% coverage. That's why you see all the advertisements for Medicare supplement, getting people who are talking to each other saying, hey, did you know that Part B only pays 80%? We better call XYZ company and sign up for Medicare supplements so we're covered for the other 20%. It's a different system when you're talking about Advantage. Again, I'll be going through Advantage in greater detail toward the end of the presentation. So Part B is based on pricing, is based on something called IRMA, Income Related Monthly Average Adjustment. The base premium is $185 a month. So if an individual makes up to $106,000 modified adjusted gross income this year, that's their premium. For a household times 2, up to $212,000. Of course, each person pays the Part B premium, and each of them are on Part B. Now that IRMA can go all the way up. It's been 612. I have projected IRMA. I don't have the final numbers, but I think it's going to be projected for the highest income of around $700 a month in premium. Okay, so A is mostly free. B, you're paying premiums. There is a Part B deductible of $257 this year, going to $288 next year. If you're in a Medicare supplement plan F, as in Frank, you don't have to worry about the deductible. It's covered. If you're in a G, you turn 65, if you signed up for Medicare after January 1, 2020, then you're going to only be able to get a G. It's less expensive, but on the other hand, there is that deductible. Okay? We don't know what these deductibles are going to be like in the future. That's one kind of hidden, danger in terms of all these discussions that are going on and the change of regulations. Treatment provided in an observation unit covered by Part B, not A. So you go to the hospital, you're in the emergency room, they keep you overnight because they're concerned about some of your symptoms. They haven't figured out the problem yet. They say, we want to keep you overnight in an observation unit. Could be located right next to the emergency room, could be up on a floor, okay? That is part B. There's two issues with that. Number one, if you don't have supplementary coverage or an advantage plan, 20% of that, because it's part B. So you're getting into some big costs when you're talking observation. You'll be responsible for 20% if you don't have the right coverage. The other thing is an observation, even if you stay overnight, you're in that hospital, but you're in something called an observation unit. That does not count towards your 3-day prior stay before you can go into and get 20 days of rehab or skilled nursing without a charge. So people want to make sure they have that 3 days. That first day in the observation unit under the hospital roof is not one of those 3 days. So I try to caution that, for people. There are some lower income programs for Medicare. I won't dote into today too much, but there's a Medicare savings program. If you're on Part B, if your income is somewhere in the 17 to 23 or 24,000, you can apply to the government to be in the Medicare savings program. Depending on what category you're in, they may even pay your Part B premium or some co-pays or deductibles as well. So that could be a real blessing. The counter to that for Part B is the Extra Help Low Income Subsidy Program, which is for people on Part D prescription drug plans, where the cost of your prescription drugs can be considerably altered. So they'll be much lower. It's a real blessing for those who need it. Okay, so raised hand, someone?
Burke? Burke, you have to unmute yourself.
Yes, she raised. Did you raise your hand, Burke?
I asked my question earlier
Okay, thank you.
when we were overriding the other.
All righty, onward we climb. Now we're into Part D. So we had A and B. I'm skipping C because C is Medicare Advantage. You don't have to have an Advantage plan. Technically, you don't have to have a prescription drug plan. You should at least have A and B. But I highly caution people, buy a prescription drug plan, even if you don't use any drugs right now, or you only use several inexpensive drugs that you're paying a basic amount over the counter for, because you never know when something will change. Middle of the year, something changes, you don't have a prescription drug plan, you can't call a company or call Mark Gottlieb and say, okay, now I decided I'm going to sign up for a Part D. Because then I'm going to tell you, now we have to wait until the next annual enrollment period. And then what you sign up for during the annual enrollment period, like what's happening right now, goes into effect January 1. So you've got a long period of time where you'll go uncovered. Now you can try to use it, one of these drug discount plans like GoodRx. Certain cases they may be helpful, but if you have a significant situation that occurs, you need expensive drugs, you could be on the line for a lot of money. So for $5 a month to join a basic prescription drug plan, I caution people, it just does not make sense not to do so, okay? They're provided by private insurance companies. Now they could be provided, of course, by managed care organizations that do offer Medicare Advantage plus prescription drug. The District of Columbia, at least that is Kaiser. In Maryland, another example of an organization that's a managed care organization is Johns Hopkins, which is a medical care delivery organization, but they also have an insurance license to be able to sell managed care, which is an insurance product. In any case, standalone companies, and a lot of these are the same ones that offer MAPDs, Medicare Advantage plans. Cigna, which is now being called HealthSpring, by the way, as of this year. So if you go online, you see HealthSpring, it's really Cigna, which is rebranded. Company called SilverScript, a lot of people have SilverScript policies, they're in a subsidiary of Aetna. AARP United Healthcare, another company called WellCare, Humana, etc. You join that insurance company plan, they in turn turn around and subcontract with all the different pharmaceutical dispensaries, so they could have contracts with 10, 15 different pharmaceutical chains, CVS, Walgreens, Target, Walmart, on and on and on. So when you're doing your shopping for a prescription drug plan, you're going to do the pricing, because sometimes based on whether these companies have preferred arrangements with the different pharmacies, you may get a better deal. There are two phases in this year. There's no longer what we used to call the donut hole. That's gone, thank goodness. The catastrophic phase, which could really apply to people with very serious illnesses taking very expensive drugs, used to be a tremendous problem, eliminated. They were both eliminated during the Inflation Reduction Act of 2022. We don't know what the new administration's going to do with all of these different plans. Everything's up for grabs. I mean, 2026 could be a very challenging year. And when I come back next year, the scene may be very different, but we'll see. But now we have two phases of coverage. Start with the deductible. This year it's $590. It's going to be most plans going to be up to $615 starting January 1. That means you're paying what they kind of consider to be retail price until you hit that amount. You then go into the copay or tier system. Okay, so if you have very expensive drugs, you may have to put out money right up front for the deductible. But I'm going to just skip down to the bottom bullet just for a minute. I should really move it up to say there is a Medicare prescription payment plan. Hard to say, isn't it? That began in 2025. If you sign up for the Medicare prescription payment plan, it will average your costs over 12 months. And you will pay the drug plan rather than the pharmacy when you go to pick up your drug. So let's just round the deductible from $590 to $600. You go, you have a very expensive drug. It's the beginning of the year. Okay, you owe us $600. If you join the Medicare prescription payment plan, you can automatically average that cost out over the cost of a year. You'd owe them $50. You're going to get billed for that through the drug plan. Again, you won't have to pay anything to the pharmacy when you go to pick up your drug. Now you get into so you get rid of the deductible, you go into the tier system. Different drugs, generics, brands, specialty drugs, anyone on insulin because of diabetes, $35 per month, regardless of which company it is. When you hit this year, when you hit $2,000 out of pocket, that's the maximum. After that, you're fully covered. So that's, to me, a real blessing. I've been selling these plans a while. That 2,000 is only going to go to 2,100 next year. So again, that's really fabulous. Okay, so now you're looking at your plan selection based on premiums plus the cost of copays. Okay, premiums is one amount. Copays can be up to 2026, 2,100. The two together will tell you what the least expensive plan for you to select is going to be. Something called the Medicare Plan Finder on Medicare.gov. You can enter all your drugs into, you put in what zip code you're in, whether you're looking for a prescription drug plan, you're getting any help, you want to see the cost of your drugs, of course, yes, that's why I'm on the site. And now you start adding your drugs. You put in the name of the drug, you hit the button next to that entry, and it will drop down and show you, do you want 10 milligrams, 20 milligrams, twice a day, 4 times a day. You put in all your drug information. And they'll bring you to a window which says, which pharmacies would you prefer to shop at, all of the things considered. Boom, you hit one more button, and now from the least total cost down, it will give you a listing of all the different plans out there. Okay, so it's not that difficult, and it makes a lot of sense. And now one other thing you want to look for, though, you want to make sure your drugs are covered as indicated by the company's formulary. Formulary is a list. I'm not doing too well here with this. There's a formulary. So the formulary is a list of drugs that are approved by a particular drug company to be offered by them and paid for. They're not all the same from company to company. Most are, but there are differences. Okay. So you see the least cost price, premium plus copays. But now you want to look and see of all the drugs. Let's say you take let's say 4 drugs. You click that button, hey, best price is this, but we're only covering 3 of the 4. Well, that's not good. So now you're going to go down to the next listing, try to find a company that's going to have 4 of your drugs. Okay, because then you know you're all covered. Yes.
Quick question. In the middle of the year, I lost the manufacturer of my thyroid medicine. So that was okay. Cigna provided another, list for me, but I had no way of gauging what those were. Were they quality? Were they generic? Did they have the same ingredients? There was no way to know, and I'm very sensitive. Just to let you know, how many companies have gone out of business this year? Any that, is that a problem or?
The drug companies, I have not heard of companies going out of business.
Okay.
Or even not offering the coverage
thing.
this year.
Yeah.
Now, when you get to Advantage plans, that's a different story. But no, I have not heard of that issue. If you have a drug that's not on the formulary, you look for a different plan that has it. They don't find it, 1 or 2 things has to occur. You have to check with your physician and say, what else can I take? It may be a generic, but then that generic button even pops up when you enter your drugs on prescription drug plan. And it'll say, hey, this drug is offered in a generic. Do you want it? Now, again, you should consult with your physician if the drug is for something significant. So you don't want to just change up. That may not be best for your body chemistry. So you want to be careful about that. And if no one's covering it, I guess the only thing you really have left is to start looking for discount drug companies that will give you some deal on that particular drug. Yes.
I apologize. The company still existed, but they stopped making my medicine. The second thing was, I asked about the generic and I just forgot what I was asking. Never mind. Sorry.
You can come back to
Okay.
it, you can email me or call me,
Thank you.
so.
Yeah.
All right,
Thank you,
so
Paul.
that's an overview of the prescription drug plan, so. Hopefully that gives you some knowledge about how to proceed. Again, any questions, feel free to reach out to me. Next few slides real quickly is some more information about Medicare Savings Program and low-income subsidies. In the interest of time, not gonna even get into this slide, but there are different categories by which they make the decisions about how much they'll help you. There's a QMB, a specific low-income Medicare beneficiary, qualified individual, which has different criteria, qualified working person. So we have to know which of the 4 categories we fit into. So that's a little bit about that situation. Retiree plan. I always go through all of this first part of the presentation, then someone says, well, I'm a federal employee, I'm a state employee, what do I do with that? Well, again, what I said up front, number 1, is these plans, their open enrollment starts November 1st, first of all. Number 2, you have to go, let's say we're talking about federal people in the District of Columbia, at least till this point in time. We don't know what to say about that, but you're working through OPM, Office of Personnel Management, or the specific branch of the different kind of coverage you have. OPM is the overview, then there are all kinds of federal programs. You have the Federal Employee Health Benefit Program, you have the postal workers, you have Government Employees Health Association, DEHA, on and on. There are 153 different plans out there. So you wanna, understand what you have and who to talk to, but that's not really part of this private system. So you're going to a different place, but you wanna know, is the coverage you have as good as or better than what you can get through Medicare individually?
I think we just finish it off.
Yeah, go ahead. Oh, we're back to someone talking to a friend. All right, I'm gonna continue. So there's the gaps, basically. Now, just ahead of time, I will say Medicaid gaps. Many people hear the word Medigap. That also means Medicare
Yeah,
supplement.
I'll just take it out of that bag as I want it.
Medigap
Bert,
plan
please mute
and
yourself.
Medicare supplement, they're one and the same thing. Okay? Typically, if you're looking at a supplement, you're looking at what are the Part A and B deductibles. Part B, 20% copay. The copay is for that 21 through 100 days. And then there's something even called excess charges for physicians who are not fully participating and willing to accept the Medicare payment as payment in full. If they are only partially participating, they have a right to give you excess charges up to an additional 15%. So for instance, Medicare supplements, some of them will even cover that 15% above. So you just want to be aware of that. Those are the main discussion points for supplements. And on the Advantage side, but here are the gaps, but they're covered a lot by Advantage to some degree, which I'll be getting to. Dental and dentures, vision and hearing, acupuncture, podiatry, and even some of them will offer you vouchers for over-the-counter medications and supplies. So I'll start with supplements and then I'll go to Advantage plans. That's okay. Supplements or Medigap policies sold by private insurance companies. They're named, and some of the companies are the same ones I showed you that offer prescription drug plans. So Cigna Health Spring, Aetna, AARP United Healthcare, Mutual of Omaha, and there are a number of others that I won't get into at the moment, but that's just an example. Humana now is selling a lot of these plans as well. So the main plan letters are plans F, G, and N. With an F, if you signed up for Medicare prior to January 1, 2020, you can get an F. If you didn't, you're talking a G. G is exactly the same except for that Part B deductible, which it would not cover. Once you pay your deductible, then you're 100%, then the 20% is fully covered. Of course, the first 80 covered by Part B of Medicare. There's an N, which is less expensive. It does have $20 copays per visit, and there's also some other medical codes for outpatient procedures or services, which you would have to pay that $20 fee. So for instance, some people say to me, well, I'm fairly healthy, I don't go for this many procedures, I'll take the N and save some money. But further yet, they'll say, well, that way I'll save some money, but if something should occur down the line, then I'll switch it to more comprehensive coverage. The answer is you cannot. There's something called medical underwriting. So they're going to review all your medical records to say, we want to give this person plan F or G insurance, or no, after what we've read on the medical record, we don't want to offer it. So then you're going to be within pretty much forever, okay? Which isn't terrible, but one has to know that. You just can't switch whenever you want, okay? So those are the main ones. Now, actually, I'll skip to the bottom just to note one other type of Medicare supplement, then I'll come back up. There are also high deductible plans. Now, they're going to be very low in premium, but the first $2,900 is a deductible out of pocket. People say, who would want to be responsible for that? Well, if you're paying $350 or $4 for a plan F or G, and you can get a high deductible for $75 a month, you may decide, okay, I'll take it. If I don't use many medical services, my premiums will low and I won't have that many deductibles to even get to $2,900. Okay? Conversely, if you have a lot of medical expenses, you'll get to the $2,900, then you'll be fully covered. The benefit of a supplement is, again, you can go to any Medicare provider in the country, frankly. I've had people call me, hey, you told me this supplement, I'm going to see some leading cardiac surgeon in Los Angeles. Will this plan cover it? Yes. Any provider in the country that offers Medicare. Okay, so those are the different plans, yeah.
How about if you travel internationally?
International is a different thing.
Okay.
Okay, some of the supplement plans say they'll cover 80% of the emergency room coverage. But, you know, you get into different systems, you don't know how they're charging, how they're coding. And that's only the true emergency. And then if you still have to be there and there are other expenses, I typically tell people who are doing travel, look into travel insurance, frankly. Okay, so those are kind of what the different types of Medicare supplements are. Now, a couple of things to remember for eligibility. You have, first of all, when you first sign up for Part B, you have 6 months to sign up for a supplement, no questions asked, okay? So you don't want to wait, you don't want to hesitate, like someone will switch out of employer coverage, okay, I'm going to sign up for B, but I'm pretty healthy, so the 20% is no big deal, I'm not going to worry about it, maybe I'll get to it. 9 months later, they say, okay, I'm ready to buy my Medicare supplement. Okay, how's your health? Well, it's okay. I'm just recovering from a mild stroke or I'm taking some serious medication. You've lost your guarantee issue, no medical underwriting. The answer is going to be, I'm sorry, you don't qualify for a Medicare supplement. You're going to have to sign up for an Advantage plan. So you have that first 6 months. Now, the other thing, people say, well, I don't really like my Advantage plan and they're denying me certain services and I've been told that it's much better to have original Medicare. That's fine. How's your health? Once again. Now, if you're moving and you have an Advantage plan and you from another geographic area, you can obtain guarantee issue. There's no medical underwriting. So I get that question a lot. Let's say an adult child says my, 85-year-old mother is moving here from Pittsburgh or Miami or wherever they're coming from. They have an Advantage plan. I know they're going to have to pick a new one because they're all different by geography. And yeah, we can sign her up for a local Advantage plan. Or did you know you can switch back to original Medicare and get a supplement with no underwriting? Some people are thrilled to hear that. So there it is, a great chance to do that. The other thing, and that's happening around here right now, if you're losing an Advantage plan because it will no longer be offered, you can either get a different Advantage plan or you can have guarantee issue Medicare supplement. It's a great opportunity to do that. As long as you have that letter from the company saying we're no longer going to be offering the plan, you can do it. So those are a couple of important points. Okay. Unfortunately, I can't give you as good a point on the birthday rule. The District of Columbia does not have a birthday rule. If you live in Maryland or Virginia, and you want to switch from one Medicare supplement to another, let's say you're shopping around, okay, I got my latest bill, because supplements will go up in price year by year, pretty much, and the price increases are getting heavier lately. And I can only imagine next year, but I don't want to get ahead of myself. But people want to shop around. Again, first question, how's your health? You have a health issue? Call me back the month of your birthday. You can shop around, guarantee issue. Unfortunately, that characteristic does not exist in the District of Columbia. It's a government insurance administration thing, okay? DC is under the rules of the federal government. They have some kind of minimum Medigap coverage rules. Maryland, Virginia will be able to overcome that. So for those in the district, I'm sorry about that. Okay, so that's supplements. Any quick questions about supplements before we go to the final segment?
So just
All
to,
right.
just to summarize, sir.
Yes, yes.
Yeah, just to summarize, so we've just talked about supplements. So these are government Medicare options, whereas
Well,
Advantage programs are going to become another whole different set of options, right? The supplement versus.
Excuse me. They're different options, but the supplement is sold, well, both of them are sold through private companies. Okay, but the advantages are much more regulated. Okay, there's a lot more contracting between Advantage and the government. You'll see why as I get to the second bullet right on this page. Okay?
Okay.
You want a supplement, I'm going to tell you, well, which plan? You want an F, you want a G, you want an N? I'm going to tell you here's 5, 6, 7 companies, and the prices can differ dramatically. Okay, so that's that. Advantage plans, and you'll see on the next page why we call them advantage plans. There are a lot of reasons why I wouldn't, but there are a couple of reasons there are. Okay, so
Can I go to the Medicare site and see these F, N, and G plans? Will they describe them there?
There's the Medicare.gov site. You put in, go to the site, and it'll say, and again, you can call me, I'll give you some information, but you go and it'll give you a chart, what kind of plans you want to look at. Supplements, Advantage, Part D. And it should spit out the same type of plans I'm speaking about. Okay? So now we're back to Advantage, provided by insurance companies or again by healthcare delivery systems licensed to sell insurance products. Again, kind of the same list of characters, so to speak. Now you must have parts A. I'm sorry for my back, by the way.
Oh, no,
Talking
fine,
to
it's
the
fine.
screen.
Never distracted.
Thank you.
I
Thank
should
you.
have sat over there.
So you must have A and B. Some people call and say, can I sign up for an Advantage plan and not have to pay my Part B premium? They don't want to even pay the $185, but if they're at the next level, it's like $235 a month based on your income, and it keeps going up. No, you can't avoid it. The only time I found you can is with certain federal plans. So people are able to not have to join Part B. So that's a tremendous advantage for them. Okay, but other than that, individuals must have Part A and B because now I'm going to join an Advantage plan. They want my A and B because anything that I use in terms of medical care, they're going to bill the government under the contract they've developed for that service. Okay. Then on top of it, they're going to charge us co-pays till we hit an out-of-pocket maximum. So they're getting paid 2 ways, through the government with the A and B contract, and then through us paying the co-pays. Make sense? So multiple types of Advantage plans. There's the regular plans. There's what's called dual eligible plans, if you have both Medicare and Medicaid. As basically considered if you're a full benefit dual eligible or QMB, qualified Medicare beneficiary. If you have either of those designations, you can sign up for a dual eligible plan. And they offer a lot of services, as you see with my note at the bottom. Dual eligible plans offer enhanced dental, over-the-counter vouchers of a greater magnitude than with regular plans. They'll provide transportation to doctor's appointments and some other benefits as well, okay? So why do you want to enroll? And the veterans plans, again, a veteran can get their drugs through the VA and still sign up for a Medicare Advantage only plan, MA, through any number of companies. 0 premium, they get a lot of extras. They get something called the buyback. I may have it on the next few pages or not, but with a buyback, they will have that veterans plan pay part of their Part B premium. So it's a tremendous benefit. Now, they will have some co-pays for using local providers. But if you don't want to go down to the VA Medical Center into Baltimore, you can join one of these plans, and there are a number of providers which are part, again, of that network, okay? So, maybe since I said I'll tell you how there's an advantage, I'll go to bullets 2 and 3. 2 very good advantages of a Medicare Advantage plan, probably the 2 best advantages. Consistent pricing and no underwriting. So whether you're 65 or 95, and you tell me how much does this plan cost? Oh, this is for $35 a month, 0 some of the plans, 95, whatever it is, same whether you're 65 or 95. That's a very nice thing. And then secondly, no underwriting, like I mentioned, with supplement plans, they could say, we don't want to accept you, your medical issues as such, we don't want to take responsibility because of the big community averaging, no underwriting. So during this annual enrollment period, or when you first join, or whatever the condition may be, they don't care whether you have cancer, whether you have a heart condition, even whether you have end-stage renal disease. They will accept you into their Advantage plan. Okay, so those are great features. Now going back up to the top again, people have to understand when you join an Advantage plan, there are co-pays per service until you're out-of-pocket maximum. For everything you do, there's going to be a copay. Primary care specialists, emergency room visits, ambulatory surgery, days in the hospital, days in rehab, therapy visits, until you hit an out-of-pocket maximum for the year, and then you're 100% covered. Now, the good news in the district is your out-of-pocket maximums are typically less than in Maryland anyway, which is where I live, so. That's a good feature of Advantage plans here. They're even lower in Virginia. So if you go in the DC metro area, the best deals are in Virginia, then the district, and us Marylanders come in last.
Really?
Seriously.
Wow, why is
Because of
that?
the regulatory system and the contractual relationships in Maryland, it's complicated, but believe me, that's the case.
If you think it's complicated, I don't know who could understand it.
Yeah, because I feel like my brain has been in a blender.
For this presentation, I apologize, but I can't
It's a
not
lot,
tell
no,
you
it's a
this,
lot of
okay?
information.
You're doing a great job.
You need to know, thank you. I'm happy to share any of this information with people. Okay, there are HMOs versus PPOs, so you're gonna see it, you know, Aetna HMO, you know, United Healthcare, AARP, PPO, whatever the company is will be followed by the letters. HMOs will only cover in-network providers, okay? So you gotta do your homework. Is my provider or my providers in the network? If so, yeah, maybe I'll join an HMO that's advantageous. On the other hand, there may be reasons you want to go out of network. It will cost you more, but at least you have some freedom. The other thing is, you know, so I've had people call me, they don't fully understand what they got into. Well, now I have a problem with my knee. I want to go to the orthopedist I used to use. I told him I'm an XYZ Advantage plan. He said, Don't worry about it, come in, I'll take your Part B coverage of the 80%, I won't bill you for the rest. Remember what I just said on the previous slide? That Advantage plan owns your A and B. That orthopod will get paid zero, so they didn't really understand it either,
Oh,
okay? A and B is now owned by whichever Advantage plan that you're in. But again, if HMO is applying for you, just be aware, in-network, and that includes hospitals. Make sure you know which hospital you would want to use if you need to, and whether that is in that network, okay? And even if the hospital's PPO, but you're paying extra, that it could be thousands of dollars more in costs. So you really want to feel comfortable with your networks, or you want to go to a PPO. The prices are similar, interesting. It's not like you can join an HMO for $30 and a PPO for $100. They're fairly similar. The differences are made up based on the copays, okay? Not the premium. Prescription drugs, you see all the ads, it makes you think, well, if I join this Advantage plan, all these expensive drugs are going to be covered. No, their system is exactly the same. You won't have a premium. The premium is absorbed in whatever the premium is for the Advantage plan, but they still operate with that tier system and with out-of-pocket costs till in next year $2,100, okay? So don't be duped by these ads that make you think, oh, I'm all set. And by the way, and I'll say that on the next page, but I get ahead of myself. Same thing applies to dental. You look at these advertisements and makes you, well, if I sign, oh, and it says dental's included. So I've got this root canal I've been waiting to get done and this bridge. No. Most of them are preventative only, so I'll get to that page next. But major issues, the networks, understand who's in and out of network. All right, you know, the other thing, again, the people may have a change of heart based on what their condition is. You may get some kind of cancer, and your brother-in-law who's in Minneapolis says, I got the best cancer specialist in the country. Why don't you come here? If you have a supplement, go. If you have an Advantage plan, maybe you'll find someone who'll take it out of network in that plan as far as away as it is, but the copays are going to be much more expensive. So just keep that in mind when you're decision making.
Mark,
Yes.
just, I'm so slow here. So at the top of your slide there, I
know,
have
throw
part,
it a lot.
I have Part A and Part B, and I'm looking at a Medicare Advantage plan that's going to pay for my copays for Part B. The first bullet about paying for a Medicare Advantage for the first 5 or 6 days of hospitalization, I don't understand how that relates
Okay.
to Part A.
Easy enough. Again, remember, you turned over your Part A and B to the Advantage plan. They're going to charge the government some amount for Part A for you. Now remember, I said they charge the government for some, they charge the enrollee for the rest. So in this case, you're the enrollee. If you go to the hospital 5 days, you're going to have 5 days worth of copays in the hospital. That'll go towards your copay at a maximum, but that will be your responsibility. Whereas if you just stayed with Part A, you'd have that deductible up front, but then 100% covered, no copays.
And this issue about being held overnight for observation and being responsible for 20% of that, is that where this would be an advantage?
Well, what I'm saying, again, using the observation example, if you were in an observation unit, Part B would pay. Well, if you're in an Advantage plan, then it would get covered only, there would be a copay. You were in a supplement plan, the supplement would pay the 20% that Part B doesn't. Okay, they're like two different systems of payment. Hopefully that covers you for the most part. If not, I'll give you my number and email address. You can consult with me. If you don't mind, I'll just say real quickly, and I said it up front, I offer all plans at no fee, so I can help people make decisions. And if I get paid by that particular company, I make a commission. If I don't, I provide you some goodwill and some help. Cause I'm a good citizen and I try to share my information. And I'm kind of a sucker too, frankly. Everyone says, why are you doing all this if they're not gonna pay you? Cause you can't not tell someone, you know, about products that I can't eat now, thank you. But I'm not paying you, okay, so that's me. So again, networks, number two, prior authorizations and denials. Now, this is just a caution. You know, I can't, there is information about it to some extent, but you hear, occasionally I get calls from people, I have to get out of this Advantage plan, they're not authorizing that I get a particular procedure or service. Or they're gonna say you need to wait until we go through the prior authorization process. We're gonna get information from the physician from this couple weeks' time. It can be a problem, but the denials for continuing service even worse. So as long as your health is decent, as long as you're getting routine, you know, regular service is fine. Once you get into more complications, it could be more complicated to get approval and to pay the co-pays for you. Okay, now just a little bit more, I'm almost done. Use a little bit more you need to understand about Advantage plans. So on the dental, a lot of them will advertise dental, but it's really preventative. Fluoride treatment, exam, x-rays, and cleaning. And that's a nice service if they're gonna pay for it. Of course, you need to use the dentists that are in their network. If you don't want to sign up, if you want more, so let's say they did the x-ray and they found you need a root canal, well, who's gonna pay for that? Well, if you bought up, then you could get some money from this plan to help pay for that root canal as an example. So you'll see in their literature, your base premium's $35, you want to buy the dental package, here's what it includes, and it's another typically in the $30 a month range. So you can add on dental that way, or you can go with a standalone dental plan. There are a lot of national companies, and there's local, like Care First has a very good dental plan. Standalone, it means it's not related to your medical care, it's just dental. You can buy one of those plans. Maybe they're a better deal than the additional dental that's being offered by your Advantage plan. And you might have, first thing you should do for dental, check with your dentist if you have one, which plans do you take? All right, they offer a hearing exam. Now, if you want hearing aids, and then it'll also be for dentures, they offer discounts from major contracted manufacturers. So they won't pay for them, but they'll give you discounts. So you even want to shop around which of the Advantage plans, all other things being equal, give me the best deal on hearing aids. Some of them may say you can get them every 2 years, some every 3 years, etc. So you need to check the details of the dental contract. Vision, pretty much 200 took glasses or lenses. Fitness facility discounts, a lot of them have contracts with a national fitness chain called Silver Sneakers that you can get discounts on joining health clubs. Some plans will offer chiropractic and or acupuncture, others won't. So again, there's a lot of shopping around to figure out what you need, what you want to do. So here's your plans in the district. There's a lot of plans. ALP United has a PPO, Aetna has an HMO POS, that's called point of service. It's a little bit more than a basic HMO, but it's less than a PPO where you go at a network. They might have some specific contracts with a few extra people other than the in-network to go point of service. Care First, 2 PPOs, Humana Choice, a PPO, Health Spring, which was Cigna, 2 HMOs and a PPO, and 3 Kaiser plans. And multiple veteran plans, each plan differs. Again, here's where all the shopping comes in. Premiums, some have deductible. You see no Advantage plans use step deductibles. But now you're seeing some Advantage plans that are being offered for $0 premium. Why would I not want $0 premium? Well, look next about, is there a deductible? So you may pay 0 premium instead of 35 premium, but it may come with a $300, $500, $900 deductible, which means you have to come up with that first amount of money. So there's all these trade-offs. There are a lot of moving parts. All right, so that's something about Advantage plans, and this is me, no fees, no obligation. All the prices are the same. For instance, if someone called, for a Medicare supplement, and they said, well, Gottlieb said it's $195 a month. So if I call directly, it's probably $175 a month because he's building in a commission, and the answer is no. Whatever prices I get, whenever I sign people up for anything, it's the exact same price if you call directly. And I have access to multiple carriers' information. But other than that, you just need information, you need materials, you need literature, you want clarification on an issue you have, just email me, probably better than phone calls with the calling back and forth. But you could set up a meeting to discuss. I've done Zoom meetings with people if they'd like to get more clarification. And so that's who I am, and I hope this was helpful to people. If there are any questions,
Thank you.
I'm happy to take them before I run off.
John, were
This
all
is
your
amazing.
questions answered?
Thank you.
John, were all your questions answered?
Yes, but could you just say one more time how the Advantage plan, did you say something to the effect that it takes oversight of Part A and B?
Well, again, you are enrolled in A and B, you shift your A and B coverage to that plan. That plan now owns your own A and B. Okay? So you get a service, they're gonna send you a Medicare number and your name and your social security number to the government to say, John is covered under Part A, here's this Part A number, give us this much money. Okay, same thing for Part B. So that's that part, and then in return, you're gonna have a responsibility for some co-pays until you hit an out-of-pocket maximum, okay?
Okay.
Hopefully that's a little clearer for you.
Thank you.
We unfortunately lost some of the women who preferred to have discussions with their friends and partake of this exciting session. So,
Thank goodness for your sense of humor.
you gotta have a sense of humor.
This has been incredibly helpful. I don't fit into any of those categories. On the other hand, I've never had insurance. I mean, I've had Medicare, I've been sick my whole
Well,
life,
you've had Medicare and then you send Medicaid for some.
but I don't understand them.
Okay,
And
well,
so I'm gonna be
you
calling
want,
you.
I'll try and explain things to
I'm
you.
coming to, and there's some conflicts there too, because for instance, if I get extra help, are they gonna cancel my QMB? I'm still the same income,
Right.
things like.
No, that just gives you extra benefits.
Right, which I never did, which would have
Because
been very-
LIS, low income subsidy for Part D, also happens to be known as extra help. And it's extra help with your drugs. So there may be a drug in a tier that's gonna cost me $11.95, depending on what spectrum I am on the Medicare savings plan categories. Instead of paying $11.95, I may pay $3.95.
It makes a big difference.
It's a huge difference.
Yeah.
Now we have to hold our breaths about what's gonna happen this year with the takeover.
There's a difference too between having an income and not having an income, and not having an income of that's enough. lends to a lot of fear, which lends to bad decisions.
Absolutely.
So that's where I am, and
Okay,
that's why.
well, I'll do what I can. I
Yeah.
can't spend hours, but I can try and give you some
Well, I'm very
information,
nervous, so it could be a
kind of
problem.
help you figure it out.
Thank you.
I try, you know, I try to help people.
I know.
I have a question
I'll
about
pay you.
United. AAPRP United. The question has to do with they change, the rate goes up in June. When I've called them and asked about what that rate would be, I've gotten the very nasty, like, what the hell is wrong with me?
Right?
You know what's going on.
First of all, they don't know yet what the rate's going up
Wow.
to for June.
But they didn't say that.
But, well, that's the truth, but,
So-
the answer, okay, so the answer for you with your Medicare supplement is, if your health is good, you can get quotes anytime. If your health is bad, then in your birth month,
But in the district, does it matter?
no.
Well,
In
I
your-
just got,
Oh, I'm sorry, it's the district birthday, no.
Right.
I'm sorry, I could move to Virginia, but I don't think I really want.
I know, it's very
We
unfortunate.
miss you, Joy.
Hey. Mark, can you hear me?
I can hear you, I don't see you.
I'll turn on the video. I had it
Well,
turned
that's
on.
okay, either way, I'm
Okay,
happy.
I'm Anita Gottlieb, Mark, by the way.
So you are
Anita Gottlieb.
Anita Gottlieb, hello,
Yes.
cousin.
What you just said was really confusing to me. I thought that the next period was the only period we could change our insurance. Is that correct?
Depends on what kind of insurance you're talking about. Annual enrollment period allows you to change your Advantage plan and your prescription drug plan, but not your supplement,
Okay.
okay? So if you're either in an Advantage plan and wanna change.
I am not in an Advantage plan. I pay for 3 different plans. I pay for Medicare, AARP, and Cigna.
Well, you probably have an AARP Medicare supplement and then
I
a
do.
Cigna
And-
prescription drug plan.
Right. Now, I've been getting notices and booklets that now is the time to make the decision about that. Is that not correct?
Well, Cigna's the Part D, so you can change your D plan if you'd like. So you should shop around and see if you can have a better deal on your D drugs. Okay? In terms of
Right, I
your
know what Cigna
supplement,
is.
in terms of your supplement, the supplement company should not be sending you a notice saying now is the time to shop for a supplement. Now, if you want to drop your supplement and join an Advantage plan, then yes, the annual enrollment
No,
period.
I don't want to do that. I want to
So
find
it's
the
only
right
plan. We're
drug
only
plan
talking-
because
We're only talking about your. We're only talking about your Part D. prescription
okay,
drug.
that's good because I take a lot of drugs for someone who looks healthy, and I find that buying them is cheaper than going through the drug plan in many cases.
Well, that could be a concern. It depends on how high tier your drugs are, but if you'd like to send me a list, I need name, dosage, and frequency. I will run, and quite frankly, none of the prescription drug plans are paying me anymore. But if you'd like, I'll do a quick complimentary analysis and give you an answer. How's that?
I'll send you some chocolates or some candy or a cake.
The
All
baker,
right, I will send it to you. Thank you, because I have a long list for someone who appears healthy.
Well, I hope it won't take 2 hours to run the list.
Well, I've got all the information on one sheet of paper. So,
Oh, that helps. Okay, we'll
Yeah.
do it. You know.
thank you.
And then, I just ask people in that instance to please share my information with others who may need help.
Sure, happy to do that.
Fair enough? All right, people. Well, then I'll wrap up.
Thank you.
Okay, And,
Thank you,
you
Mark,
know
for a
where to
great
find me.
presentation.
Thank you.
I appreciate it.
Okay,
All right, and if you all need
Thank
more
you.
information, this is recorded, so we'll post it on the webpage by the end of the week. And I have Mark's contact information if you need to get in touch with him. And you didn't copy the information off the slide.
Okay, so.
Okay. All right, well, thank
All
you
right,
so
thank
much,
you.
everybody. Going to leave the meeting.
I gotta leave and run to my next person. Okay, so much fun.
LRJF@946.
Thank-
Okay, LR.
Thank you all. Thank you, Mark.
Thank you.
Then I'm gonna email it to you, and all you would need to do is, when you go to member login, it'll ask you for your login and your password. So copy and